Hi everyone, welcome back to the White Coat Club. My name is Nicole and I'm one of the counselors at Moon Prep. Muskan is here with me again today, and we're going to be talking about shadowing, how to get it, what to do, and kind of why it's so important. So as always, don't forget to like and subscribe to receive more BSMB content in the coming weeks. So we're going to jump right into it. So obviously, Muskan and I are coming from a little bit of a different perspective. Both counselors at Moon Prep who help students um, through the application process, but myself coming from more of a counseling background and Muskan coming from the medical background, we're going to kind of talk about our different perspectives into why counseling is so important and the best ways to get it. And once you've obtained it, what to do. So, kind of just jumping in, why is shadowing so important? If you are applying to BSMD programs, shadowing proves commitment and an understanding of the medical field. It's also going to help confirm that medicine is something that you really want to do. So how do you know it's something you want to do if you've never had any experience in it? That's why shadowing is key. Being able to showcase to the admission staff that you have a little bit of a background in it, and you understand a little bit of the way that things go is going to help you kind of prove that to admissions. Was there any other thoughts there of the why?
Yeah, I think those are really good points, especially the point about confirming whether or not medicine itself is something you really want to do, more specifically the physician role, because I've had friends who shadowed in high school or shadowed in college during their pre-med years and decided that they actually wanted to become a nurse or they wanted to become a physician's assistant. So it's really, a good way to see what are the different roles that occupy the healthcare team. A lot of students kind of know what a doctor does, if you have a family member, family friends, but it's really hard to get a full idea of what you're going to be doing day to day unless you're there in person seeing what really goes down in the clinic because without that background, it's just hard for students to have an accurate picture as to, how much of your day is actually spent seeing patients, how much of it is spent ordering medications, how much of it is spent writing notes. So I think it's just always a good primer for students to be able to go in and see how physicians live day to day. But based off of that, Nicole, do you have some suggestions as to where students could shadow?
Yeah, so most of our students are looking to shadow in either hospitals, physician offices, or private practices. So, and we'll get into like how to obtain for each, but that's primarily where most students are going to be shadowing.
Oh, okay. Those are really good options. And then how can students actually get into these spaces? How can they obtain shadowing hours?
Yeah, that's a great question. It's a little bit different for each one. So, if you're just looking off the bat, I'll start with this one because it is true for a lot of our students, not always, but a lot of people want to go into medicine because they have family members in medicine. So many students look to shadow family members who are physicians or even friends of family members. So, maybe parents or someone in the medical field and you don't want to shadow them or that's not possible. So you can shadow one of their colleagues or one of their other professional friends. Um, if you don't have any family in the medical field, which not everybody does, of course, reaching out to your own personal family doctor. So either that could be your family physician, your pediatrician, your parents' physicians, even your dentist, orthodontist, physical therapist, things like that. Kind of reach out to the professionals that you already know, that you have a rapport with already. Discuss with them this is what you want to do and see if they would have any options or any suggestions for you. Now, if you've gone that far and really nothing is kind of sticking or coming into place, we're going to want to reach out kind of on a broader scope. So, contacting offices in your area. You can call them and inquire about potential opportunities for shadowing. Always try to follow up with a resume and an email. And that's going to be for like offices, private practices, things like that. Now, if it's through a hospital or even like a large medical corporation, so depending on where you are in the country, there's, large scale hospital organizations. A lot of them have online applications. So definitely check out their websites first. They have applications where they use to accept student volunteers. They'll tell you different locations that they are. So I know like in North Carolina area, it's Novant Health, and that's including all the Novant Health family offices, pediatrician offices, hospitals, it's everything. Same for the New York area, it's Northwell. So any type of doctor's office or hospital that is owned or run through Northwell, all the applications are going to be online through their website. Most applications are due in the spring, and they typically accept summer volunteering opportunities while students are out of school. Even broader of a scope, if you, the student, has a personal LinkedIn account, you can search for doctors there. Definitely not your parents' account, but only from a student account. You can reach out on LinkedIn. I think this is most effective if you, as the student, have a LinkedIn and it's active. So if you're doing research, you're doing other shadowing things, and it's all posted on LinkedIn, that's going to be great for you to use, to reach out and to network. Um, and then if all else fails, of course, you're going to be consulting with us through the way, but get creative. I mentioned this before. Some students will shadow dentists or orthodontists. And even if you have no desire to go into dentistry, you're not so much learning the skill. So the main shadowing is not to learn that exact skill, but just understand, doctor communication with patient advocacy and just like best practice on a large scale, dealing with patients, dealing with collaboration with, either the nurses or the dental assistants, things like that. It doesn't need to be specifically tied to a field that you're interested in. You're still going to gain really meaningful experiences from there, which will kind of showcase through your stories. Anything else to add on to there?
No, not really. I think you covered it really well. Getting creative is like a thing that I feel like a lot of students forget to do because you know, it's really hard to get position sometimes. And as someone who had to go the broader scope route in the past, because I don't have people that I know in medicine for the most part, it really took a lot of persistence and digging and trying to find opportunities by really reaching out to the community as much as possible. And then are there any things that students should avoid when looking for shadowing opportunities?
Yeah. Oh, as always, there's going to be some rules to that. So, we slightly mentioned this before. Parents reaching out to someone, it should really, really be coming from the student. Um, I kind of said this again, but if it's the parent's position that you already have a rapport with, that's a little bit of a different line, more of a gray area. But parents should absolutely not just be reaching out to people or on social media that is not already a connection. If it's a parent's friend who is a physician, that would be acceptable, and they'll make the connection and the introduction to the student. But I have seen it. I know you've experienced it and seen it firsthand as well. Parents just on their own Facebook accounts, like reaching out into the community, like, can anyone help my child, and let them shadow. Um, it should really be coming from the student. So we kind of want to avoid that Facebook, and then overstepping boundaries, really understanding when to draw the line. And I know you probably have more stories for that than I would specifically. So really understanding and recognizing the boundaries and when not to overstep them. I've seen students do it. I've seen parents do it. Like I said, um, just in my own personal neighborhood. But I know, Wisconsin, you probably have some other examples of that as well.
Oh yeah, definitely. I think that I've had people reach out to me and I'm not even a doctor yet, so that was a little confusing to me. And I've had, just like in general, kind of not very professional ways of reaching out. At the end of the day, yes, you're in high school, you're looking for opportunities, which may be hard to come by, but you always want to come off as professional. These people that you might be shadowing, these physicians or other healthcare workers, might even end up writing you a letter of recommendation, and you really only want them to have like glowing things to say about you, which includes saying that were respectful and professional and not imposing upon them. And then like another thing is, just making sure that you're not completely badgering them with requests. One way that I found really helpful in high school was when I was reaching out to physicians, I would just make a quick spreadsheet. I'd write down the clinic's name, the doctor's name, and then how I contacted them, whether it was phone or email. And I would just write down the date of when I first contacted them, and I would make sure to wait a few days. So at least like 4 to 5 days, um, because doctors are really busy people. And at the end of the day, if they're deciding to help you out, it's really out of the goodness of their hearts. They're not really gaining very much from this. They just want to help you out. So just being respectful of their time, you can wait 4 or 5 days and then maybe reach out one more time and know once you've reached out twice, you haven't really received a response. I would consider that a dead end and look for other opportunities elsewhere. But having a spreadsheet really helped me make sure that I wasn't consistently just badgering the same clinic with requests because I know like sometimes, students don't want to be too persistent or, come off as annoying or anything. But, when you're applying to 50 clinics, it can get hard to keep track. So that's just another idea to make sure that um, you're not presenting yourself in a way that might look unfavorable.
Those are some really great points. Definitely understanding the professionalism and recognizing that down the line, like you said, they could be really valuable to you in terms of writing recommendations. So always wanting to kind of lead with that best foot forward. Um, so once you get your shadowing, finally, you have a placement. I know you've gone through this firsthand. So what are some like key things that you need to make sure that you do once you obtain that?
Yeah, so just a few tips, I guess, before your actual first day of shadowing would be to reach out to the doctor or clinic coordinator. Sometimes the doctor will give you like the email address or phone number of someone who organizes all the students working with them. So reach out to whoever your point person is and ask if you need to bring anything. Usually the answer is going to be no, besides the couple things that I'm going to tell you that you should take. But for the most part, they'll probably not have anything very specific for you to take, but it's always just a nice gesture to show that you want to be prepared. I would ask if you should wear business attire or scrubs. So, most clinics will be fine with business casual if they don't tell you or if you don't get a chance to ask or if that's something that you forget to ask and it's like the weekend and you start on Monday, business casual should be completely fine. If they tell you to get scrubs, just order some off of Amazon. They're not very expensive. I wouldn't go and buy fake scrubs or anything in high school. I think that's complete overkill and not a good investment of your money at all. But you could just grab like a cheap pair of scrubs off of Amazon, or if you're in a time crunch, even I think Walmart or Target might sell something. Or ask around, if you know someone in the community who is a healthcare worker, it should not be too difficult, hopefully, to obtain a pair of scrubs. Um, Besides that, I would, take a small pocket notebook, bring a pen, and then just bring some food and drinks to get you through the day. You'll probably notice that a lot of physicians are really busy and oftentimes don't have lunch breaks built into their day. So just grab like a few snacks that you can munch on throughout the day. Because you're a high school student, you're probably not used to the lifestyle of really busy physician yet. So you want to make sure that you're not, crashing in the middle of the day because you haven't had anything to eat or drink. And then finally, this is just like something that's nice to do. It's absolutely not required, but you could read up on some common conditions within that specialty. Obviously, you're just in high school, so when you walk in, literally no one expects you to know anything at all. Um, but it might just help you feel a little bit more comfortable going in, if you know some general things. If you're going to an ophthalmology clinic, for example, that's where I shadowed for the very first time. Um, Maybe like just look at a diagram of the anatomy of the eye. So that, when the doctor tells you something is wrong with the cornea, you know what that is. Or if someone tells you that there's something wrong with the retina, you know what that is. If you're going into primary care or OB-GYN, primary care, maybe look up a few things that are really like important to know, some chronic conditions that a lot of people have. High blood pressure. Okay, so well, what is blood pressure? What is the number that doctors look for to diagnose high blood pressure? They're not going to sit there and ask you all of the different medications and the dosing. That's something that, even at my level, I'm still learning and I will continue to learn. But in high school, you should at least know going in, like, maybe these are three or four conditions that I might see time and time again. Um, and then like for example, dermatology is another place that I shadowed. Dermatology is like a little bit more difficult because it's just so specialized. But for example, before I went in, I just looked up what are the different layers of the skin. What are the three different types of skin cancer? Nothing super in depth, but a quick read up. You can even ask like some AI agent to help you if you don't even know where to start. What is like a quick primer of this specialty that I should know about going into shadowing?
Those are some really great points. There's a few things that you specifically said that I've absolutely dealt with students. The attire for sure. I've had students who are like, oh, I actually need to get scrubs beforehand and I didn't know. They told me on the first day. So it was like a weird kind of hiccup. So having asked beforehand is definitely a really good idea. Another thing that you said that I really loved is just looking at specific terms, kind of general terms to that field, I think are great. It's so easy to go on Google and say, what are the top things to know, if you're interested in dermatology or like you said, layers of the skin or parts of the eye, like just basics just helps the conversation flow a little bit better when you're in that position. So I think that that's really great. Um, okay, so what about, before your first day, all the things to prepare? What about when you're actually there? Is there any like rule of thumb or things that you think are important to know?
Yeah, definitely. So, the very first thing I would do when you walk into the clinic is just introduce yourself to the front desk staff as the student who's, shadowing or working with the physician. Let's say you're working with Dr. Smith. Really simply going up to the front desk saying, "Hey, I'm a student and I'm here to work with Dr. Smith today." A lot of times, like, I don't know why, like students, I mean, I do know why, because I was in your shoes at one point. It can be very nerve-wracking and it can be kind of confusing walking into a clinic for the first time and you don't really know where things are or who anyone is. But you don't want to just sit in the waiting room, twiddling your thumbs because then people are going to get confused and the doctor's going to think that you were late. So make sure you go make your presence known and introduce yourself to someone who works in the clinic and, basically every single time I've done that, they've been super happy to help and they show me where to go or where to wait for the doctor and things are all good. So don't just, show up and sit there. Like make sure that you have made your presence known in the office because oftentimes the doctor is like sitting in the back, in their office getting prepped for the day. So they won't know that you've arrived. So it's just a good thing to give them a heads up. I mean, I guess also if the doctor gives you their phone number and tells you to text them or something like that, you could also always do that, like, hey, I'm here. But most of the time, you can just go to the front desk and let them know. Be sure to be kind to everyone, um, your evaluations are based on the type of person you are. And at the end of the day, the type of person that we want in medicine, that we want as coworkers in the future are really kind people. So be kind to every single person, patients, the physician, obviously, and then also every single other person that walks in the door in that clinic that is working there. Um, this is not a time to be standoffish or indifferent and, whatever. Just be nice, be a kind person. Make sure to take notes on things that you find interesting while you're in the exam room. So, if the doctor says that there's like a cool condition that this patient has, that they want you to look up, then, just jot it down. Or if there's like a term that you hear very frequently, you don't know what it means, just jot it down. But don't be buried in your notebook the whole time. I'm sure you can relate to this as well. If I was a patient and there's just someone in the room not making any eye contact, just like furiously, jotting away in their notebook, I would be a little uncomfortable. So make sure that you're also like present in the moment. But if you want to jot down a few terms to look up later, that is more than appropriate to do. And then kind of going off of that, if a doctor asks you to look something up, look it up. This is not usually just like oh, you should look this up for, I mean, for the most part, it's like for your own knowledge, obviously, because you're in high school and it's not you're not directly caring for patients yet. But at the same time, they want to see, are you willing to learn? Are you willing to be coached by someone who is a senior to you? So make sure that you are, if they ask you to look something up, jot it down and make sure you look it up. And later on in the day, let's say you look it up when you have a break between patients, you can just say, hey, I actually looked up that thing that you had mentioned in that patient room. This is what I found. And you can have a really good conversation with the doctor where it can be a teaching moment for you. Or, if it's at the end of the day, go home and look it up and then talk about it the next morning. And then when you're in a patient room, make sure that you're being very respectful of the space that you're in. Patients feel very vulnerable sometimes in physicians' offices, and they bring up really vulnerable conversation topics. It's really a privilege to be in that room. So make sure that, you're being respectful of the space. You can stand to the side of an exam room. That's usually totally fine. Don't interrupt the visit. Don't interject if the patient says something. If they ask you a direct question, of course, answer. A lot of patients that I have seen when I was shadowing are very interested to know what kind of doctor I would want to be, or what I'm interested in, or just know like a question about where I go to school. And that's more than okay to answer, but don't interrupt the visit when the patient is talking to the physician. And if you have questions, jot them down and ask them later. Do not make it uncomfortable for the patient or the physician by randomly asking questions while the visit is taking place. Um, and then finally, try to be helpful in small ways if possible. So this is not going to apply to every single person based on where you are. Like if you're in a hospital setting, it's usually harder to help out with smaller tasks because they have so many staff members. But if you work in a smaller clinic, you can just, make it known that you're willing to help. You can tell the nurses, the medical assistant, even the doctor, hey, if there's anything I can do to make the patients more comfortable or to make the appointments run more smoothly, please let me know. Some things that you could do is, you could offer to show patients to the front after their appointment. This is like a very underrated task for some reason because sometimes these clinics are so crazy and they're like a maze, so patients get really confused on their way out. So, just walk a patient to the front desk after they're done so that they can check out. You can offer to help with wheelchairs if a patient comes in with a wheelchair, and let's say whoever is with them has their hands full. You can say, "Hey, let me help you to the front desk or let me help you to the door." You can help the medical assistants with resetting the room. So, everything has to be wiped down. The paper on the bed needs to be redone. So, that's like something nice as well that you can really be helpful with. You're probably not going to be allowed to do anything clinical to help out with, but even like helping with small admin tasks can make the day go by more efficiently. And I'm sure that it would be much appreciated by the physician that you are willing to pitch in and help, even if it's just a little bit.
Yeah, and I feel like the more, courteous you are, the more respectful you are, the more like willing to help and jump in that you are, like it could open more doors for you, A, to shadow more or to continue to shadow or like to potentially like do other things. Like definitely never be like sitting if there's downtime, like not to be sitting on your phone, but like you said, look up certain things or like find helpful ways. Like they at the end of the day, this is their career and they're really doing you a favor by allowing you to kind of be a shadower. So you made some really, really great points about just being respectful and courteous that I think are extremely, extremely important. They don't have to invite you back. They could have you there for one day and then realize, you know what, this isn't a good fit. So really, really go with your best foot forward. So kind of leaning on the courteous side, they're doing you a favor. So after you're done shadowing, once the agreement is kind of over or the summer's over, any next steps to kind of ensure that you left on a good foot?
Yeah, definitely. So I would start by writing a thank you to the doctor and clinic staff. They really put in they have to sometimes put in more work to have a student there. Sometimes, the days you get a little bit less efficient. Sometimes patients might run behind because the doctor's, really trying to teach you things while you're in the patient room. So it's just a nice gesture to say thank you, and write them a nice message about how they've helped you out. And then also in the message, I would just include a little sentence at the end about, I'd love to stay in touch with you as I go through my medical journey. And just like that little bit can also signal to them that you might reach out in the future for letters of recommendation or such, because it's just a nice way to keep that relationship ongoing, even if you're not going into the clinic every day. It's just something that they have on their radar that you might reach out in the future. And then this is something that, I would say you should do at the end of your shadowing rotation, or you can also do it at the end of each day, but just write down some reflections. If you have a patient story that's exceptionally memorable, the way that a physician talks to a patient that makes them feel welcome, or if you have like, you know, a really like nice connection that you're able to make with a patient, I would just jot it down in your notebook because this can be really good material for essays and for interviews in the future. And, when you're looking back, let's say you shadowed someone in sophomore year of high school, and then you're like a rising senior trying to write your essays, it can be really difficult to remember these moments. So just having a journal where you reflect is really nice. And then also, like at the very end of your shadowing rotation, I would just do a quick reflection of your experience, what you thought of the specialty, what really stuck out to you. And I would also like make reflections about how people worked in the clinic, what teamwork looks like, what collaboration looks like, just so you have that material for later. And it'll just make essay writing go by so much smoother. Nicole, do you have anything else that you would recommend students do once their shadowing is wrapped up?
I absolutely agree. With the writing letters, writing their names down, like almost everyone you interact with, put down who they were. You never know who you're going to come in contact with later on, or if someone says, "Oh, I used to work at that clinic. Who did you shadow with?" And you can't recall their name, um, just like little things. I had a conversation with a student about that actually last night. I said, "Oh, what was the doctor's name?" And they couldn't even recall it in the moment. So just try to keep a journal, definitely write thank you notes, but I think that was awesome. So all of this super, super great advice. I appreciate your perspective as someone who has done this specific shadowing. Um, so this was kind of a one part to our two-part series. So this was all about shadowing. And during our next episode, we will be discussing research side of things, similar, how to obtain it and what are some best practices. So we will catch you in the next one.